Hello and welcome. If you're in the final weeks of pregnancy and wondering whether your body is starting to prepare for labor, this video is for you. Many moms feel anxious when they start noticing new sensations in their bodies and ask themselves the same question: am I starting to dilate? The truth is that your body gives several natural signs as it gently prepares for birth. Some of these signs can appear days or even weeks before labor begins, and understanding them can bring a lot of peace of mind during this exciting stage of pregnancy. In today's video, we're going to talk about the most common symptoms of cervical dilation, what they may feel like, and a few simple and non-invasive ways to observe how your body might be progressing toward labor. And before we begin, if you enjoy calm, supportive, and evidence-based pregnancy content that helps you feel more confident about your journey to motherhood, make sure to subscribe to the channel, like this video, and turn on the notification bell so you never miss our weekly pregnancy guides. Now, take a deep breath, get comfortable, and let's explore together the gentle signs that your body may be getting ready to welcome your baby. Cervical dilation is a natural and gradual process that prepares your body for birth. Cervical dilation is one of the most important processes that happens as your body prepares for birth. Throughout pregnancy, your cervix remains closed and firm in order to protect your baby and keep them safe inside the uterus. As the end of pregnancy approaches, however, your body slowly begins to prepare for labor by softening and opening the cervix. This change does not happen suddenly. Instead, it usually occurs gradually and gently as hormones begin to signal that your baby is getting ready to be born. Your body is incredibly intelligent and knows exactly how to prepare itself for this important moment. Many women imagine dilation as something dramatic that happens instantly, but in reality, it is often a slow and natural process. Your cervix may begin softening, thinning, and opening little by little, long before labor truly begins. Understanding that dilation is a gradual process can bring comfort and reassurance. It reminds you that your body is working step by step to prepare for one of the most incredible experiences of your life. During most of pregnancy, the cervix stays long, firm, and closed to protect the baby from infection and keep the pregnancy stable. This protective structure acts almost like a strong door that remains shut until the body is ready for labor. As pregnancy progresses into the final weeks, hormones such as oxytocin and prostaglandins begin to influence the cervix. These hormones help soften the cervical tissue and prepare it to slowly open. This process is sometimes called cervical ripening. The cervix becomes softer, shorter, and more flexible so that it can gradually begin to open during labor. Knowing that your body is carefully preparing itself in advance can help you feel more confident and calm as you approach the end of pregnancy. Every woman's experience with cervical dilation is unique. Some women may begin dilating slowly over several days or even weeks before labor begins. Others may notice that dilation progresses more quickly once contractions start. Both experiences are completely normal and simply reflect how each body works differently. The important thing to remember is that there is no perfect timeline for dilation. Your body will follow its own rhythm and natural pace. Trusting this process can help reduce anxiety and allow you to focus on listening to your body as it prepares for birth. The cervix is measured in centimeters during dilation, from 0 to 10 centimeters. At 0 centimeters, the cervix is still completely closed. As labor progresses, the cervix gradually opens until it reaches 10 centimeters, which is considered fully dilated and ready for the baby to move through the birth canal. This opening process allows the baby to safely pass from the uterus into the world. Understanding these stages can help you feel more informed and prepared as labor approaches. Cervical dilation is only one part of the overall preparation for birth. Another important change is effacement, which refers to the thinning of the cervix. Before dilation can fully occur, the cervix usually becomes shorter and thinner. This process allows the cervix to stretch more easily during labor Effacement and dilation often happen together during the final weeks of pregnancy. These natural changes are signs that your body is preparing in a healthy and normal way for the arrival of your baby. Many women wonder whether they will feel their cervix dilate. In many cases, early dilation happens without noticeable symptoms. Your body may already be 1 or 2 centimeters dilated before you feel any contractions or signs of labor. This is why cervical dilation can sometimes begin quietly in the background as your body prepares. Knowing this can help you understand that not feeling anything unusual does not mean your body isn't preparing for birth. In the final weeks of pregnancy, your baby usually begins moving lower into the pelvis. This movement places gentle pressure on the cervix. This pressure can encourage the cervix to begin opening gradually. It is one of the ways your baby and your body work together during the preparation for labor. Many mothers notice increased pelvic pressure or heaviness during this stage. These sensations are often a normal sign that your body is progressing toward birth. It is important to remember that cervical dilation does not always mean labor will start immediately. Some women may remain slightly dilated for several days or even weeks before active labor begins. This is simply part of the natural preparation process. Your body is slowly setting the stage for the moment when labor will begin. Learning about cervical dilation can help replace fear with understanding. When you know what your body is doing, the process can feel less mysterious. Education is one of the most powerful tools for reducing anxiety during pregnancy. By understanding the natural stages of labor preparation, you can approach birth with greater confidence. Many mothers find that knowledge helps them feel calmer and more empowered. Your body has been preparing for this moment throughout your entire pregnancy. Every small change plays a role in helping bring your baby safely into the world. Cervical dilation is simply one part of this incredible process. Trust in your body's natural ability to prepare for birth. Each step brings you closer to meeting your baby. Many women assume that cervical dilation only begins once labor contractions start. However, the body often begins preparing for labor much earlier. In fact, the cervix can start softening and opening before active labor begins. These early changes are part of the body's natural preparation process. Some women may notice subtle signs during the final weeks of pregnancy. Recognizing these signs can help you feel more aware and connected to what your body is doing. Early cervical changes can occur gradually and sometimes without noticeable symptoms. Your cervix may slowly begin to soften and open, even while you continue your normal daily activities. This preparation helps make the transition into active labor smoother. It's one of the ways the body gently prepares for the birth process. In the weeks leading up to labor, your body releases hormones that begin signaling the cervix to change. These hormonal shifts help the cervix become softer and more flexible. This process prepares the cervix to open more easily once contractions begin. It's a remarkable example of how the body coordinates every step of pregnancy and birth. Some women may already be 1 or 2 centimeters dilated before they even realize labor is approaching. This is actually very common and considered completely normal. The body often begins these preparations quietly in advance. This allows labor to progress more efficiently. Once contraction, experiencing early dilation does not necessarily mean that labor will start immediately. Some women may stay slightly dilated for several days or weeks before active labor begins. This is simply part of the natural preparation process. Your body is slowly getting ready for the big moment. Early signs of cervical change can include sensations like pelvic pressure or occasional mild cramping. These sensations are usually gentle and may come and go. They are often your body's way of signaling that things are gradually progressing. Listening to these changes can help you feel more in tune with your body. It's also important to remember that every pregnancy is different. Some women experience many noticeable signs before labor, while others experience very few. Both experiences are completely normal. Your body will prepare for birth in the way that works best for you. Understanding these early changes can help reduce anxiety during the final weeks of pregnancy. When you know what to expect, new sensations can feel less worrying. Instead of feeling uncertain, you may feel reassured that your body is doing exactly what it should. Knowledge helps transform uncertainty into confidence. If you ever feel unsure about symptoms during late pregnancy, your healthcare provider can always offer guidance. They can help you understand whether what you are experiencing is part of normal labor preparation. Remember that asking questions is always feeling informed is an important part of feeling calm and prepared. As the final weeks of pregnancy unfold, your body continues preparing for birth in many subtle ways. Early cervical changes are simply one part of this process. Each small change brings you closer to the moment you will finally meet your baby, and that moment is worth every step of the journey. During the final weeks of pregnancy, many women experience a sudden sharp sensation in the pelvic area, often called lightning crotch. The pain may sound unusual, but the sensation itself is quite common. This feeling is usually described as a quick, shooting pain in the lower pelvis, vagina, or rectum. It may last only a few seconds before disappearing. Although it can feel surprising or uncomfortable, it is generally considered a normal part of late pregnancy. In most cases, it simply means that your baby is moving lower into your pelvis. As your baby prepares for birth, they begin settling deeper into the pelvic area. This process is often called baby dropping or lightning. When this happens, your baby's head may place pressure on nerves and ligaments in the pelvis. That pressure can sometimes create the sudden sharp sensation known as lightning crotch. Even though the sensation can feel intense for a moment, it usually passes quickly. The pelvic area contains many sensitive nerves that support the uterus and surrounding structure. As your baby moves lower, these nerves may occasionally become compressed or stimulated. This can trigger short bursts of discomfort that feel like quick electrical shocks. While surprising, these sensations are typically harmless. Lightning crotch often becomes more noticeable when you change position, stand up suddenly, or walk. Movement can shift the baby slightly, causing pressure on pelvic nerves. This is why some women notice the sensation more frequently when they are active. Resting or adjusting your posture can sometimes reduce the intensity. For many women, lightning crotch appears during the final weeks of pregnancy. This timing is not a coincidence. It often happens because the baby is moving deeper into the pelvis in preparation for birth. This positioning can also help encourage cervical. It's important to remember that lightning crotch does not necessarily mean labor has started. Instead, it usually indicates that your body and baby are gradually preparing for labor. Many women experience this sensation days or weeks before contractions begin. It is simply another sign that your pregnancy is progressing. If lightning crotch becomes uncomfortable, gentle movements and posture adjustments may help. Some women find relief by sitting down or shifting their weight slightly. Prenatal stretching and pelvic relaxation exercises can also help reduce pressure. These simple techniques may make the sensation easier to manage. Staying calm when you feel lightning crotch is important because the sensation is sudden. It can sometimes feel alarming at first. However, once you understand why it happens, it often feels much less concerning. Knowledge can transform a surprising sensation into a reassuring sign of progress. If the sensation is ever accompanied by severe pain, bleeding, or unusual symptoms, contacting your healthcare provider is always recommended. However, in most cases, lightning crotch is simply part of late pregnancy. Your body is adjusting as your baby prepares for birth. These sensations are usually temporary. For many expectant mothers, lightning crotch becomes just another memorable part of the pregnancy. It may be surprising at first, but it often means your baby is moving closer to the position needed for birth. Your body and baby are working together in remarkable ways. Each sensation is part of the incredible preparation for meeting your baby. Losing the mucus plug is a natural sign that your cervix is softening and preparing for labor. Throughout pregnancy, your body forms a thick barrier of mucus in the cervix known as the mucus. This protective plug plays an important role in keeping bacteria and germs from entering the uterus. It helps create a safe environment where your baby can grow and develop. The mucus plug remains in place for most of pregnancy. As the end of pregnancy approaches, the cervix begins to soften and change. These changes may cause the mucus plug to loosen and eventually come out. This process is completely natural and often occurs during the final weeks of pregnancy. Many women notice it as a thick, jelly-like discharge. The mucus plug can vary in appearance. It may be clear, cloudy, slightly pink, or even streaked with small amounts of. These variations are usually considered normal. They simply reflect small changes happening in the cervix. Some women notice the mucus plug all at once, while others lose it gradually. In some cases, it may appear in small pieces over several days. Both experiences are perfectly normal. Every pregnancy progresses differently. Losing the mucus plug does not always mean labor will begin immediately. Some women go into labor within hours or days, while others may still have weeks before delivery. It is simply a sign that the cervix is beginning to change. Your body is preparing for labor in its own time. Many women notice the mucus plug when using the bathroom or wiping. Because it can look different from normal discharge, it may catch your attention. Understanding what it is can help prevent unnecessary work. In most cases, it is a healthy and normal sign. The loss of the mucus plug is often associated with cervical thinning and dilation. As the cervix begins to open slightly, the plug may no longer stay in place. This is part of the body's preparation for labor. It allows the cervix to continue changing. Although losing the mucus plug is normal, heavy bleeding is not. If you ever notice bright red bleeding similar to a menstrual flow, contacting your healthcare provider is important. Light spotting or pink streaks, however, are usually normal. They are often referred to as a bloody show. Understanding the role of the mucus plug can help you feel more prepared for late pregnancy changes. Many women feel reassured once they learn that this is part of the natural birth preparation process. Your body knows how to protect your baby and prepare for delivery. Each step is carefully coordinated. When you notice the mucus plug, it can feel like an exciting milestone. It means your body is beginning to transition toward the final stage of pregnancy. While labor may not start immediately, it signals that things are moving forward. Your baby's arrival is getting closer. A small amount of spotting, known as a bloody show, can be a normal sign of cervical change. The term bloody show may sound alarming at first, but it is usually a normal part of late pregnancy. A bloody show refers to light spotting that appears as the cervix begins to soften and open. This spotting is typically pink, brown, or slightly red. It often appears mixed with mucus. As the cervix begins to change, tiny blood vessels in the cervical tissue may break. This can create small amounts of blood that mix with mucus. The result is the discharge known as a bloody show. This is often a sign that labor may be approaching. Many women notice a bloody show during the final days or hours before labor begins. However, it can also appear several days before contractions start. Each pregnancy follows its own timeline. The important thing is understanding that this sign is often normal. A bloody show is usually light in amount. It may appear as streaks of blood within mucus or as light spotting on underwear. It should not resemble heavy menstrual bleeding. Heavy bleeding should always be evaluated by a healthcare provider. Seeing a bloody show can sometimes feel emotional for expectant mothers. It may signal that the long journey of pregnancy is nearing its final stage. Many women describe it as one of the signs that birth is approaching. This moment can bring both excitement and anticipation. A bloody show is often associated with other signs of cervical change. These signs may include mild cramping, pelvic pressure, or the loss of the mucus plug. Together, these symptoms suggest that the body is preparing for labor. They are part of the natural progression toward birth. It's important to stay calm when noticing a bloody show. Although the name sounds dramatic, the amount of blood is usually very small. Most women experience it without complications. Understanding this helps reduce unnecessary worry. If the spotting becomes heavy or bright red, contacting your healthcare provider is recommended. Heavy bleeding is not considered normal during pregnancy. However, light spotting associated with mucus is usually harmless. It often simply reflects cervical. Many women notice the bloody show shortly before contractions begin. This makes it one of the signs that labor may soon follow. However, the timing varies widely from person to person. Your body will progress according to its own natural rhythm. Recognizing the signs of a bloody show can help you feel more prepared for labor. Instead of feeling alarmed, you may feel reassured that your body is beginning its final preparation. Each change is part of the journey toward birth. Soon, you will finally meet your baby. Mild cramping, similar to menstrual cramps, can indicate that labor is beginning. One of the earliest sensations many women notice when labor begins is mild cramping. These cramps often feel similar to menstrual cramps and are usually located low in the abdomen. At first, these sensations may be gentle and irregular. They might come and go without a clear pattern. Because the discomfort can be mild, some women initially assume it is simply another late pregnancy symptom. However, these early cramps can sometimes be the very beginning of labor. Early labor cramps typically appear just above the pubic bone or across the lower abdomen. They may also extend into the lower back or pelvis. These sensations occur because the uterus is beginning to contract and the cervix is slowly opening. Each contraction helps the cervix thin and dilate. At the beginning, contractions may feel very similar to period cramps. They might last only a short time and occur far apart. Some women describe them as a tightening sensation across the abdomen. Others notice a dull ache that gradually increases in strength. As labor progresses, these cramps usually become more regular. They may begin to appear every 20 or 30 minutes. Over time, the intervals between contractions become shorter. This pattern helps signal that labor is moving forward. The intensity of these cramps also tends to increase gradually. Early contractions are often manageable and may allow you to continue normal activity. As labor advances, they typically become stronger and more noticeable. This gradual progression helps the body prepare for birth. Many women find comfort in gentle movement during early labor. Walking, changing position, or using breathing techniques can help manage mild cramping. Staying relaxed can also support the natural progression of labor. Your body knows how to guide the process. It is important to listen to your body as these sensations develop. Keeping track of contraction timing can help you recognize whether labor is progressing. Many women use contraction timing apps or simple timers. This can provide helpful information for your healthcare provider. Early labor can last several hours or sometimes even longer. During this stage, the cervix is gradually opening. Although progress may feel slow, every contraction plays an important role. Your body is working step by step. Rest, hydration, and calm breathing can help support you during early labor. Many mothers find comfort in staying relaxed and conserving energy. This preparation can help when contractions become stronger later. Labor is a marathon, not a sprint. Mild cramping at the start of labor is a normal and healthy part of the birth process. These early sensations are signs that your body is beginning the work of bringing your baby into the world. Each contraction gently moves labor forward, and with every step, you are getting closer to meeting your baby. Cervical dilation rarely happens all at once. Instead, it usually progresses slowly over time. Your cervix gradually opens from 0 centimeters to 10 centimeters during labor. This gradual process allows the body to adjust naturally. Each stage prepares the body for the next. Many women are surprised to learn that dilation can begin before active labor. Some women may already be 1 or 2 centimeters dilated without feeling any contraction. This early dilation is often discovered during prenatal appointment. It simply means the body is beginning to prepare. The early stages of dilation are often the slowest. Your cervix may open very gradually during early labor. Once active labor begins, dilation typically progresses more quickly. This is a natural pattern of labor. Every woman's body progresses at its own pace. Some women dilate slowly over many hours. Others experience more rapid changes once labor begins. Both experiences are completely normal. Healthcare providers measure dilation in centimeters. When the cervix reaches 10 centimeters, it is considered fully dilated. At this stage, the body is ready for the pushing phase of labor. This is when the baby begins moving through the birth canal. Dilation often occurs alongside other changes, such as effacement. Effacement refers to the thinning of the cervix. Together, these changes prepare the cervix to stretch for birth. Both processes work together during labor. Movement and upright positions can sometimes help labor progress. Walking, rocking, or using a birthing ball may encourage cervical change. Gravity can assist the baby in moving lower into the pelvis. This natural movement may support dilation. Patience is important during labor. Because dilation takes time, many mothers find that staying relaxed helps the process. Stress and tension can sometimes slow progress. Calm breathing and support can make a big difference. Support from partners, family members, or healthcare providers can help mothers feel more comfortable during labor. Encouragement and reassurance can ease anxiety. Feeling safe and supported helps the body work effectively. Labor is both a physical and emotional experience. Understanding that dilation takes time can help mothers approach labor with realistic expectations. Rather than worrying about speed, it can be helpful to focus on progress. Each contraction and each small change moves labor forward. Your body is working exactly as it was designed to. As labor approaches, your body often begins sending subtle signals that change is happening. These signals may appear gradually over several days or weeks. They are part of the body's natural preparation for birth. Learning to recognize them can help you feel more confident. Some of these clues include pelvic pressure, mild cramping, or changes in vaginal discharge. You may also notice that your baby settles lower in your pelvis. This movement can make breathing easier, but increase pressure below. These sensations are often signs that your body is preparing for labor. Another clue can be changes in energy level. Some women feel a burst of motivation to organize or clean shortly before labor. This instinct is often called the nesting instinct. It is a common experience in late pregnancy. Sleep patterns may also change during the final days of pregnancy. Some mothers feel restless or find it difficult to sleep deeply. Others may feel unusually tired. These changes are simply part of the body's preparation. Increased pelvic pressure is another common symptom. As your baby moves lower, the weight on your pelvis increases. This pressure may make walking or standing feel different. It is often a sign that your baby is settling into position. Back discomfort can also appear as labor approaches. The baby's position may place additional pressure on the lower back. Gentle stretching or warm showers can sometimes help relieve discomfort. These sensations are often temporary. Digestive changes can also occur before labor. Some women experience loose stools or mild nausea. These symptoms may occur as the body begins preparing for labor. Hormonal changes often play a role. It is important to remember that these clues can appear differently for every woman. Some women notice many signs, while others notice only a few. Both experiences are completely normal. Your body will follow its own path. Recognizing these subtle clues can help reduce uncertainty. Instead of wondering what is happening, you may feel reassured. These changes are often part of the body's natural preparation. Your body is guiding you toward birth. Every small signal your body sends is part of a larger process. Together, these clues create a picture of progress. They remind you that labor is approaching, and soon you will meet your baby. Many women assume that the only way to measure cervical dilation is through a medical examination. However, there are also natural signs that may indicate labor is progressing. These observations can sometimes provide helpful clues. They allow mothers to stay more aware of their bodies. One interesting example is the appearance of a purple or dark line between the buttocks during labor. Some research suggests that this line may rise higher as dilation progresses. Although it is not visible in every woman, it can sometimes provide a visual indicator. This observation is known as the purple line. Another natural observation involves changes in the height of the uterus during labor. As contractions continue, the muscles of the uterus draw upward. This movement can change the distance between the top of the uterus and the rib cage. Some midwives use this as a rough indicator of progress. Body awareness can also provide helpful clues. Women often sense changes in pressure, contractions, or pelvic sensation. These physical feelings can help mothers recognize that labor is progressing. Listening to the body can be very valuable. Breathing patterns may also change during labor. As contractions intensify, breathing often becomes deeper and more focused. Many women naturally adopt rhythmic breathing. This helps the body cope with contraction. Sound can also reflect labor progress. Some women make deeper vocal sounds during stronger contraction. These sounds are a natural response to intensity. They can also help release tension. Movement patterns may change as labor advances. Women often sway, rock, or shift positions instinctively. These movements can help manage contraction. They also assist the baby in moving downward. It is important to remember that these signs are only general observation. They do not replace medical assessment when needed. Healthcare providers are always the best source for precise measurement. However, natural signs can still offer helpful insight. Understanding these non-invasive clues can help mothers feel more connected to their bodies. Instead of relying only on external information, they can observe their own progress. This awareness can bring confidence and calm. Labor becomes a more intuitive experience. Natural observations remind us that the body has remarkable ways of guiding the birth process. Your body communicates through sensations, movements, and subtle signals. Learning to notice these signs can be empowering. It allows you to participate more fully in the experience of birth. Knowledge can be one of the most powerful tools during pregnancy and birth. When you understand what your body is doing, labor can feel much less mysterious. Instead of fear, knowledge often brings calm and confidence. Preparation can transform uncertainty to trust. Many women feel more relaxed when they learn about the stages of labor. Understanding how the cervix dilates and how contractions progress can make the experience feel more predictable. This information helps mothers recognize what is normal. It reduces unnecessary anxiety. Education also helps mothers recognize when to seek support. Knowing the difference between early labor and active labor can guide decisions about when to go to the hospital or call a provider. This awareness can make the experience smoother. Preparation provides clarity. Confidence during labor often comes from trusting the body. Your body has been preparing for birth throughout the entire pregnancy. Every hormonal change and physical adjustment plays a role. Your body knows how to guide the process. Breathing techniques, relaxation, and supportive environments can all help during labor. When mothers feel calm and supported, labor often progresses more smoothly. Confidence encourages relaxation. Relaxation helps the body work effectively. Support from partners, family members, or doulas can also increase confidence. Encouraging words and emotional support make a meaningful difference. Labor becomes a shared journey rather than a solitary experience. Feeling supported strengthens resilience. Preparation through childbirth education classes can also be helpful. Learning about labor position, breathing techniques, and coping strategies can build confidence. Practice before labor often helps mothers feel ready. Preparation creates reassurance. It is also helpful to remember that every birth experience is unique. There is no single correct way for labor to unfold. Flexibility and openness can help mothers adapt to changing circumstances. Birth is a personal journey. Trusting yourself and your body is one of the most powerful things you can do during labor. Your instincts and your body's signals often guide you toward helpful movements and positions. Listening to those signals can support the process. Your body and baby work together. When knowledge, support, and trust come together, labor can feel much less intimidating. Instead of fear, many mothers experience a deep sense of strength and empowerment. Every contraction brings your baby closer, and soon, you will finally hold your baby in your arms.